What self-care practices do you recommend for women to prioritize their health and well-being, especially considering the demands of daily life?
I think that's a very good point, especially I like how you coined the question, considering the daily life, because we currently are living in a time when finding time to take care of yourself is very difficult, and this usually has an impact in your general health, not only your general health, but also your gynecological health. So the same practices that we recommend, I think, cut across board. Things as simple as, number one, exercise. I think we all come into contact with content that say exercise is good for you and all of that. We all know that exercise is good for you, but how does this play into your gynecological health and your general and overall health? So what usually is recommended is incorporating exercise into your daily routine, so that even as you're, let's say for instance, walking down the stairs or walking to work, things as simple as, instead of, let's say for instance, when you go to work or you go to a mall, I think the tendency is to park as close as possible to the entrance and as close as possible to the exit. I don't know if there's somebody who... To the lift, exactly. I don't know if there's somebody who usually finds the farthest parking. I don't think so. So the way to incorporate this into your daily routine is look at the things that you're doing. Make it a conscious effort that when I park or when I alight from the vehicle, I'll use that opportunity to walk from where I came out of the car to the building. That is considered also part of exercise. Every day, if you incorporate at least 3 times a week, 30 minutes of exercise, which can include something as simple as walking, even with, add the children into the exercises that you're doing. Simple things in the house like dance videos. I know we're talking about screen time. You can incorporate it into your screen time. Doing dance videos, anything that keeps you moving is considered exercise. Anything that makes your heart rate to go up is exercise. And why is it important? We find that we have gynecological conditions that are very common and we see in the offices, such as irregular, bleeding, irregular periods. We have conditions such as endometriosis, which is becoming increasingly common. Endometriosis means when you have excessively painful periods. So there are very many conditions which are triggered by imbalances in hormones. And exercise is actually part of the interventions that we do for some of these conditions. We recommend daily exercise. Conditions such as polycystic ovarian syndrome, which is also very common, where women present with irregular periods. So exercise is very important in that sense. So we try as much as possible to incorporate this into our daily activities. The second thing about exercise, it's not just about your entire body moving, it's also about what we call pelvic floor exercises. And this cuts across board, from women who are pregnant to women who are postnatal, they have delivered few weeks, few months ago, and even postmenopausal women. Incorporating these pelvic floor exercises into your daily activities and daily routines. Even if you do a simple search on your phone, you'll see the techniques that you can use to incorporate this. And what are the benefits of this? Number one, it helps to reduce complications such as incontinence that can come, as you progress in life. It helps in women who are pregnant. It reduces the duration of labor. It prevents complications that are associated with weakening of the muscles. So that is the first thing that I think we could all do with improving. And the second thing is diet. Diet is also very important. It cannot be stressed enough. Whatever we incorporate not just about the quantity per se, but the quality of food that we're taking. For instance, one of the common things that we try to discourage is sugary foods. And this cuts across board in terms of prevention of things like diabetes, hypertension, but also from a gynecological standpoint. One of the common conditions that we get is vaginal infections, vaginal discharges, vaginal odors, and still in the same line of irregular bleeding, irregular periods. All of these things are tied towards hormones, and the diet really has an important influence on how our hormonal balance is every month. So what we recommend is, other than incorporating healthy foods like vegetables, particularly leafy green vegetables, make sure that in the diet you try to cut off as much sugars as possible. These are processed foods. We all like our ordering foods online and all of that, but we try to keep it more of home-cooked meals, more of fresh fruits and vegetables. If we're taking juices, we take more of blended juices, and this will help to improve not only the vaginal health, it will improve the hormones in the body and the balance of the hormone. So even women who are approaching menopause or postmenopausal, it helps to reduce the symptoms of menopause. So diet is also very important, and also regular checkups with a gynecologist. I think one question I like to ask patients when they come into my office is this the first time you're seeing a gynecologist? And most of the time it will be yes. Okay. Is there anyone who has seen a gynecologist here outside of pregnancy? You can see that most of the time you'll find that you'll only visit a gynecologist if you have a problem, if there's a symptom that you're having, or you visit a gynecologist if you're pregnant. It's not very common to have, just a routine checkup. Visiting a gynecologist should be like visiting a dentist. We all know that, you should have at least a yearly or half-yearly dental check. So it's the same thing with a gynecology visit. At least every year you should do a routine gynecology checkup as part of wellness. The reason why we say this is because of, of course, the usual routine screenings that we do, but also sometimes women have problems which they may not identify it as being a problem. Like for instance, the painful periods. I think sometimes in the society we've been raised up that women should, periods are painful, periods cramping is normal, but really it's not always that cramping is normal. Sometimes it could be something that can be treated. Sometimes it could be something that needs medication. So just incorporating routine gynecological checkups into it. And the last thing that I'll talk on is hygiene, just basic routine hygiene. And this is not the usual showering, but I'll just address the issue of douching. I think douching is something that is being promoted in the social media and all of that. Douching means using either soaps or water or other substances to wash inside the vaginal area. We don't recommend douching. I know that is a misconception that is there. Sometimes it can cause you to have recurrent vaginal infections. So maintain routine hygiene, but avoid routine vaginal douching.